The treatment goals of patients with schizophrenia vary depending on the circumstances, but in the conversations that I've had in various studies, we quite often hear patients wanting to return to a situation before they had schizophrenia. They talk about a previous life that was colourful, that had vibrancy, that had relationships, where they had the possibility of doing things. And even if a patient is 65-year-old, they still talk about this world before schizophrenia. And I think that this is one of the key elements behind the recovery movement, notion of can we not just minimize the symptoms, but get people back to this colourful world that they once lived in and work towards that as a goal. What is a world that has colour, that has meaning to people with schizophrenia? It is subjective. It depends on the individual goals and wishes and talents of the people with schizophrenia. But that is, I think, a lofty goal, and we have to both use the medications that we have in better ways, but I also think that we need to think about moving the evaluation paradigm to understand, document, appreciate and evaluate the therapies and treatment programs that we have in a way that is much more patient-centered than we have traditionally in the past. I think when you speak to a physician and ask, are you patient-centered, most physicians are going to say yes. We have to look at their care patterns. Some physicians pick a particular treatment and use that treatment for everyone. And I don't think that that is akin to the type of shared decision-making, informed discussion, needs assessment type of paradigms that are emerging in patient-centered care. So there are certainly good instances around the world of people embracing that. There are people who are aiming for recovery, for a more normal life with people with schizophrenia, but it is a difficult disease, and there are ups and downs in treating it, and it is very hard to kind of continue to focus on this. I'm reminded by a young physician that I was working with when I said, we really should ask the patients what they wanted. And they went, what if they wanted to jump out the window? Would you let them jump out the window? And in all the time that I've spent talking and doing research with people with schizophrenia, no one's wanted to jump out the window. They are very understanding. This is a chronic disease. People with schizophrenia have it for a very long time and have experienced a wave of different treatments over the years to do this. They've had different experiences with different sectors of the healthcare system. They've had positive experiences and negative experiences. They're a wealth of knowledge, and I don't think that we're actually going to account for true patient-centered or goal-centered care until we both understand that in the clinical encounter, but also on national agendas, in the evaluation paradigms. We need to have ways of understanding this more holistically.